Hello there, how are you? I hope you are in fine cheers and in great health. Eyes are invaluable. They have been known as windows to the soul. Yet they are probably the most neglected of all organs. About 70% of the population runs into some kind of trouble with the eyesight during their lifetimes. So today we will discuss about the eye and the related vision defects. To understand the vision defects, it is very necessary to understand the structure of the eye. About 1/6 of the eyeball is externally visible. This part is also protected by the eyelids. The eyeball is made up of 3 concentric coats. The outer fibrous sclera, also called the white of the eye, the middle blood vascular choroid, and the inner nervous retina. The sclera is thick, tough, white and opaque. It maintains the shape of the eye, protects the inner structures, and creates the darkness inside the eye. The middle coat of the eye, the choroid, is made up of blood vessels and hence nourishes the eye. The inner retina consists of numerous nerve cells which receive light rays coming from the outside world, convert them into the electrical impulses and transmit them to the brain. The black or the dark brown part of the eye is called the iris. It lies exactly behind the cornea. At the center of the iris is a small circular opening called the pupil, which allows the light rays to enter the eye and controls their intensity by changing its size. Behind the iris is the crystalline lens, which is normally transparent. It is held in place by 72 suspensory ligaments. From the back of the eyeball starts the optic nerve, which conveys the electrical impulses originating in the retina to the brain. The part of the brain which is concerned with the vision is called the visual cortex. It is here that the impulses coming from the retina are processed and interpreted, and the person thus is able to see. Our eye is a wonderfully efficient organ. It produces images by collecting and processing the reflected rays of light that bounce off the surface of everything around us. As soon as the light touches our eyes, the pupil responds, contracting or dilating. Once it passes through the pupil, the light is directed by the lens to the image transmission center of the eye. Yes, retina. The retina transforms the light images into encoded electrical impulses that travel to the brain, where they are registered, evaluated, and reacted to an instant. Thus, the eyes are only light collecting centers. Actual seeing is the function of the brain. The information gathered by the eyes is combined within the brain with our knowledge, memory, and emotions. Vision is the product of this blending. There are basically 4 defects or the vision problems commonly suffered by the people: myopia or short-sightedness, hypermetropia or far-sightedness, astigmatism, and presbyopia. Let us look at each of them in detail. Myopia or nearsightedness. It is a visual defect in which a person cannot see distant objects clearly. The near vision is usually quite good, as the name suggests. In myopia, parallel rays of light coming from distant objects are bent more than normally inside the eye. so that they come to a focus some distance ahead of the retina. Hence the image formed on the retina is fuzzy and the person sees blurred images. Hypermetropia or farsightedness is a visual defect in which the distant vision is usually quite good, but the person experiences difficulty while performing a near-point task. If the defect is severe, even the distance vision may be subnormal. Even in such cases, the difficulty for work at near distance is much greater than that for working at a distance. In hypermetropia, parallel rays of light coming from distant objects on entering the eye are bent less than normal, so that they come to focus some distance behind the retina. Divergent rays of light coming from nearby objects come to a focus farther behind the retina, and thus the object seen is fuzzy and hence the blurred vision is produced. Astigmatism is a visual defect which is caused by an irregularity in the surface of either the cornea or the crystalline lens. When corneal or lenticular surface is regular, all the light rays entering the eye form a focus point. But if a corneal surface is irregular, that is either steeper in one plane or flatter in the other or vice versa, the light rays entering the eyes form two separate focal lines. A person with astigmatism usually sees a part of an object more clearly than the part situated at a right angle to the former part. Presbyopia is a condition where the accommodation of the eye is no longer sufficient to see the objects clearly at the usual reading distance of approximately 40 cm. This is due to the fact that the lens of the eye gradually starts to lose its elasticity from the day we are born. Hence the crystalline lens loses its elasticity and thus a blurred vision is produced. Let us have a look at the cure available. The first one is refractive surgery. This is said to be a permanent solution to get rid of glasses or lenses. This includes correction of the defective vision with the surgery. Laser eye surgery or LASIK is done on the cornea. The laser beam models and forms the corneal tissue in micrometers, whereby the cornea receives the correct curvature and the defective vision is cleared up. Lens implantation is used to correct more serious defective vision as well as presbyopia. Let us have a look on how the surgery is being performed. In a way, the operation is quite simple. It is usually performed on persons suffering from short sight. This is usually done in 3 steps. Step number 1. A small incision is made and the corneal flap is opened. Step number 2. The cornea is reshaped. This consists of making 8 to 16 radial incisions on the cornea. This results into flattening of the cornea. Step number 3. The open flap is closed. Parallel rays of light which previously converged to a focus point in front of the retina now comes to a focus exactly on the retina and the person is able to see clearly. There are usually many complications associated with the surgery. Even the doctors advise the persons coming to them before the surgery that these many complications are present and they are willing to accept those. Let us look at them. In many cases, within 3 to 5 years, the visual defect returns with a vengeance. Yes, even the doctors say that the operation is apparent and temporary. Persons who undergo this operation shows a decreased tolerance to light. Many persons continue to suffer from photophobia and glare even 6 months after the operation. If the corneal incision turns out to be deeper than desired, the cornea may get perforated with disastrous results. Complications that occur include injury and inflammation of the iris, injury to the eye lens, and even formation of cataract. After the operation, in many cases, the corneal surface becomes irregular and uneven. In such cases, normal sight cannot be restored with glasses or contact lenses. Pus-forming organisms might grow in the corneal incisions. In severe cases, corneal ulcers might result and the sight may even be lost. Well, why to move towards such complications and ruin yourself? At PCTC, we have number of healing modalities which can cure these vision defects. Acupressure, which is known as the best treatment for curing these vision defects. It is the treatment of organs via the correspondence points. Magnetotherapy, application of the proper magnets at the proper places, improves the eyesight in a considerable amount of time. At PCTC, we have developed a special program for eyesight improvement. After assessing the eye, proper exercises and home remedies are suggested, which significantly improves the eyesight in a considerable amount of time. We present to you some self-care tips to prevent the eye disorders. Try to read in a proper lighting that will not cause any unnecessary stress or strain in the eyes. Rest the eyes whenever they are tired. Do not force yourself to read when the eyes are beginning to show the signs of fatigue. Do not sit in front of TV or computers for prolonged periods of time. This can also damage your eyes. Eat fresh fruits and vegetables which are particularly rich in vitamin A and vitamin E. This will help you boost the vision. Quit smoking and any other type of addictions to ensure healthy eye. Try to resist playing video games and reading books while traveling in moving vehicle. This causes strain in your eyes. I hope that you got enough information on the human eye and its related vision problems. For more details, you can log on to our website healthforall.wix.com/pctc, or you can email us your queries and problems at write2pctc@gmail.com. Follow us on Facebook at Panesha Cosmic, and for any other queries or problems, you can contact us on the mobile numbers on your screen. Thanks for watching. Enjoy a healthy weekend. Bye bye.